Other information about COVID-19. Can COVID-19 be caught from a person who is asymptomatic? COVID-19 is mainly spread through respiratory droplets expelled by someone who is coughing or by a person who has other symptoms such as fever or breathlessness. Many people with COVID-19 experience only mild symptoms. This is particularly true in the early stages of the disease. It is possible to catch COVID-19 from someone who has just a mild cough and does not show any symptoms of COVID-19. Some reports have indicated that people with no symptoms can transmit the virus. But it is not yet known how often it happens. Can children or adolescents catch COVID-19? Research indicates that children and adolescents are just as likely to become infected as any other age group and can spread the disease. Evidence to date suggests that children and young adults are less likely to get severe symptoms, but severe cases can still happen in these age groups. Children and adults should follow the same guidance on self-quarantine and self-isolation if there is a risk that they have been exposed or are showing symptoms. It is particularly important that children avoid contact with older people and others who are at risk of acquiring more severe form of the disease. Is there any vaccine, drug or treatment for COVID-19? While some Western traditional or home remedies may provide comfort and alleviate symptoms of mild COVID-19, there are no medicines that have been shown to prevent or cure the disease. WHO does not recommend self-medication with any medicines, including antibiotics, as a prevention or cure for COVID-19. However, there are several ongoing clinical trials of both Western and traditional medicines. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19 and will continue to provide updated information as soon as research results become available. Are antibiotics effective in preventing or treating COVID-19? It is a big no. COVID-19 is caused by a virus. Antibiotics do not work against viruses. They only work on bacterial infections. Antibiotics should not be used as a means of prevention or treatment of COVID-19. In severely ill patients, doctors will sometimes use antibiotics to prevent or treat secondary bacterial infections, which can be a complication of COVID-19. They should only be used as directed by a physician to treat a bacterial infection. Do pets or other animals spread COVID-19? Several domestic dogs, cats, and tigers in contact with infected humans have tested positive for COVID-19. Ferrets appear to be susceptible to the infection. In experimental conditions, both cats and ferrets were able to transmit infection to other animals of the same species. However, there is no evidence that these animals can transmit the disease to humans and spread COVID-19. COVID-19 is mainly spread through droplets produced when an infected person coughs, sneezes, or speaks. Prevention is better than cure. Maintain a distance of at least 1 meter from others. Wash hands regularly with soap and water or clean with alcohol-based hand rub. Use common household disinfectants to clear the surfaces at home that will kill the virus. Disclaimer: this information is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a doctor for further advice.